Welcome to another SF non-fiction book summary. I'm your host, Sam Fury, and in this episode, we are summarizing Outlive by Dr. Peter Attia. Outlive by Dr. Peter Attia focuses on proactive and personalized approaches to enhance longevity and health quality. It covers strategies like early disease detection, tailored nutrition, regular exercise, managing emotional health, and embracing medical innovations. The book also explores the impact of genetic factors, lifestyle choices, and modern medical practices on diseases and aging, advocating for an integrative approach to prolong health span. Chapter 1. The Long Game. This chapter emphasizes proactive medicine for longevity. It advocates early intervention and lifestyle changes to prevent chronic diseases and improve life quality. Focus on early detection and management of health risks to prevent chronic diseases. Regular health checkups and awareness of family health history can aid in this. Monitor and maintain healthy metabolic markers like blood glucose levels to prevent conditions like type 2 diabetes. This can be achieved through a balanced diet and regular exercise. Pay attention to nutritional intake, emphasizing the importance of proteins and a balanced diet tailored to individual metabolic needs. Incorporate a regular exercise routine suited to your physical capabilities to improve overall health and longevity. Address and manage emotional health as it significantly impacts physical health. Practices like meditation, counseling, or stress management techniques can be beneficial. Chapter 2. Medicine 3.0. This chapter highlights the challenges in medical innovation and risk management. It contrasts conservative medical practices with the need for adaptive, risk-aware approaches in treating patients. If existing medical routines compromise patient care, propose or implement more effective solutions. Actively seek and incorporate new methods and technologies that improve patient outcomes. Evaluate medical decisions by thoroughly weighing risks and benefits rather than relying on emotional judgments. Tailor medical treatments to individual patient requirements, considering their unique health circumstances. Prioritize preventive measures in healthcare to address potential health issues before they escalate. Continuously educate yourself about medical advancements and emerging research to enhance patient care quality. Chapter 3. Objective, Strategy, Tactics. This chapter emphasizes the importance of strategizing for a healthy, active old age, recognizing the potential decline in later years, and adopting a comprehensive approach to prolong health span, not just lifespan. Envision activities you want to do in old age and plan to maintain abilities for them. Create a broad plan for a healthy old age, focusing on physical and cognitive health. Focus on enhancing the quality of life, not just its length. Modify your health strategy as new information becomes available and as personal circumstances change. Integrate exercise, nutrition, sleep, emotional well-being, and, if needed, supplements into daily life. Chapter 4. Centenarians. This chapter explores the lives of centenarians, suggesting that their extreme longevity may involve genetics, lifestyle choices, and resilience, rather than specific health habits. Engage in regular physical activity to potentially influence gene expression related to aging. Keep track of cholesterol and glucose levels as part of routine health checkups. Prioritize a diet rich in nutrients to support overall health and potentially impact longevity. Aim for a holistic approach to health, targeting not just diseases, but overall well-being and quality of life. Chapter 5. Eat less, live longer. This chapter explores the discovery of rapamycin and its impact on medicine, particularly in longevity and transplant therapy. It also highlights the potential of caloric restriction and rapamycin in extending lifespan. Adopt a diet with reduced caloric intake without malnutrition to potentially extend lifespan. Ensure the diet is nutritionally balanced while containing fewer calories. Engage in regular physical activity to activate AMPK, enhancing cellular stress resistance and metabolic efficiency. For those interested in rapamycin's potential benefits, consult a healthcare professional for guidance, especially given its complex effects and potential side effects. Chapter 6. The Crisis of Abundance. This chapter discusses the broader implications of metabolic health disorders, including obesity, insulin resistance, and the impact of diet. In any medical context, ensure accurate and thorough reporting of personal habits like alcohol consumption to healthcare providers. Regularly check liver enzyme levels, such as ALT, and consult healthcare professionals for interpretation, considering that normal levels might not always indicate a healthy liver. Make conscious changes to diet, increase physical activity, and improve sleep patterns to enhance metabolic health and prevent related disorders. Reduce the intake of high fructose foods and beverages, focusing on whole foods to prevent metabolic issues. Chapter 7. The Ticker. This chapter discusses heart disease, emphasizing genetic predisposition, early detection through CT scans, and the importance of understanding cholesterol's role in cardiovascular health. Assess your family's health history for heart disease. If there's a history, consider earlier and more frequent health screenings. Get a CT heart scan to detect early signs of atherosclerosis, especially if you have risk factors or family history. Regularly check your lipid profile to assess cardiovascular risk. Incorporate a diet low in saturated fats and rich in monounsaturated fats like olive oil and avocados for better heart health. If lifestyle changes aren't enough to lower cardiovascular risk, consult a healthcare provider about statins or other lipid-lowering medications. Chapter 8. The Runaway Cell. This chapter provides a comprehensive overview of the challenges and advancements in cancer treatment, particularly focusing on immunotherapy and the importance of early detection. Early-stage cancers have fewer mutations and are more treatable. Advocate for early, aggressive cancer screening. Surgery and chemotherapy have limitations, especially for metastatic cancers. Immunotherapy shows promise in treating cancers by enhancing the body's immune response. Obesity and diabetes are linked to increased cancer risks. Focus on metabolic health as a preventive strategy. Combining treatments like PI3K inhibitors with diets or other drugs can improve outcomes. A multi-pronged strategy, including prevention, targeted treatment, and early detection, is crucial. Weigh the financial, emotional, and health risks of cancer screenings against the benefits of early detection. Chapter 9. Chasing Memory. This chapter emphasizes the importance of early detection for neurodegenerative diseases, particularly Alzheimer's disease. Identifying risk factors like the APOE4 allele can help in taking preventive measures. Conditions like Alzheimer's are limited. Lifestyle changes are crucial. Genetics play a significant role in the risk of developing neurodegenerative diseases, but they do not guarantee disease onset. Metabolic health, particularly glucose metabolism, is closely linked to brain health. Managing blood sugar and insulin resistance is important in reducing the risk of Alzheimer's. Regular physical exercise, including strength training and cardiovascular activities, is one of the most effective ways to reduce the risk of cognitive decline and neurodegenerative diseases. A diet rich in monounsaturated fats, low in refined carbohydrates, and including fatty fish can be beneficial, especially for those with high genetic risk. For some, a ketogenic diet might offer benefits by diversifying the brain's energy sources and improving cognitive function in early-stage neurodegenerative diseases. Quality sleep and managing stress help in reducing inflammation and maintaining healthy brain function. Hearing loss and poor oral health are emerging as potential risk factors for cognitive decline. For women, hormone replacement therapy during menopause, might be beneficial. Regular sauna use may reduce the risk of Alzheimer's disease and cardiovascular diseases, although more research is needed to confirm this. Supplements like omega-3 fatty acids, vitamin D, and B vitamins might help in lowering the risk of Alzheimer's. Chapter 10. Thinking Tactically. This chapter emphasizes adapting to modern life's challenges for longevity. It identifies the mismatch between our genetic makeup and the drastically changed modern environment, particularly concerning diet, activity, and social structures. There are 5 tactical domains for improving health: exercise, nutrition, sleep, emotional health, and exogenous molecules. There is no one-size-fits-all solution. Continuous learning and adapting based on personal needs and scientific advancements is needed. Focus on improving aerobic efficiency, maximum aerobic output, strength, and stability. Tailor dietary habits to balance calorie intake, ensure adequate protein, and maintain metabolic health. Enhance sleep quality and duration. It impacts insulin sensitivity, exercise performance, and emotional well-being. Develop tools and techniques to manage and improve emotional health. Be informed about the use of drugs, supplements, and hormones for health. Regularly evaluate personal health metrics like triglycerides, liver function, glucose tolerance, body composition, and bone density. Chapter 11. Exercise. This chapter emphasizes the profound impact of exercise on longevity and health. Aim for a balanced fitness routine, avoiding extremes in any single type of exercise. Regularly assess and improve VO2 max, cardio, and muscle strength training, as these are key indicators of health and longevity. Adopt a holistic approach to fitness, preparing for a range of physical activities to maintain functionality and health in later life. Chapter 12. Training 101. This chapter goes into the specifics of physical training for longevity. Engage in low-intensity aerobic activities like jogging or cycling to improve metabolic health and utilize fat as fuel efficiently. Regular aerobic exercise, particularly in Zone 2, supports mitochondrial health, crucial for energy production and overall metabolic health. Incorporate higher intensity exercises to boost VO2 max, a key indicator of aerobic capacity and longevity. Regularly engage in resistance training to combat muscle mass and strength loss, especially focusing on type 2 muscle fibers. Heavier weights, explosive exercises, and power movements. Develop stability to prevent injuries and enhance overall fitness. Stability acts as a foundation for all other physical activities. Focus on the controlled lengthening of muscles, the eccentric phase, in exercises for improved strength and injury prevention. Regularly train grip strength, as it's a strong predictor of overall health and longevity. Incorporate exercises like deadlifts and squats to strengthen the glutes, hamstrings, and lower back. Practice activities like rucking, walking with a weighted pack, to build strength, endurance, and cardiovascular health. Continuously evaluate and work on improving basic functional movements like carrying, pulling, and stepping to maintain physical independence. Keep track of bone mineral density, especially as you age, through weight-bearing exercises and nutrition. Recognize the importance of adapting exercise routines to age-related changes in strength, endurance, and flexibility. Align exercise routines with personal life goals and activities you want to enjoy in later years. Consider consulting fitness professionals for proper technique, especially for complex movements. Chapter 13. The Gospel of Stability. This chapter emphasizes the importance of stability in fitness, particularly as we age. It discusses the risks of injury from lack of stability, the role of proper movement patterns and breathing, and the necessity of retraining our bodies to move correctly to maintain health and prevent injuries. To incorporate stability training into your fitness routine, practice exercises focusing on ideal movement patterns and breathing techniques. Learn and apply the principles of dynamic neuromuscular stabilization for better movement control. It involves retraining the body to use natural, ideal movement patterns learned in early childhood, focusing on stability and efficient, safe motion control. Train to create intra-abdominal pressure for spine stabilization. Use deep, controlled breathing to expand the entire rib cage and belly. Exhale fully with pursed lips, maintaining tension in the abdomen. Repeat in sets, integrating this technique into exercises like squats or deadlifts for core and spinal support. Perform exercises like the step-up with proper technique to strengthen stability and avoid injury. To perform a step-up, place one foot on a box with your thigh parallel to the floor. Inhale deeply, shifting weight forward. Push down with the front foot, extending the hip to stand atop the box. Exhale while stepping up. Lower back slowly, maintaining balance and control. Repeat on each side. Regularly assess and adjust your fitness routine to ensure proper form and movement control. Chapter 14. Nutrition 3.0. This chapter critiques the simplistic understanding of diet and nutrition. It advocates for a personalized, scientifically rigorous approach, rejecting one-size-fits-all diets and emphasizing individual differences in nutritional needs and responses. Avoid oversimplified diet rules and listicles. There isn't a universal diet suitable for everyone. Tailor your eating habits to your unique physiological and metabolic requirements. Concentrate on basic nutritional rules like balancing calorie intake, ensuring adequate protein and essential fats, and getting necessary vitamins and minerals. Recognize the difference between nutritional behaviors for maintaining health and those for correcting poor health or disease. Chapter 15. Putting nutritional biochemistry into practice. This chapter emphasizes that diet alone cannot guarantee health or longevity. It critiques the standard American diet for its unhealthy, highly processed nature and explores various dietary strategies for improving metabolic health. Focus on lowering calorie consumption to address overnourishment and metabolic health issues. Track daily calorie intake and gradually reduce it while ensuring nutritional needs are met. Ensure adequate protein intake to maintain muscle mass, aiming for at least 1.6 grams per kilogram of your body weight per day. Include protein-rich foods in every meal and consider protein supplements if needed to meet the daily target. Adjust fat intake to have a higher proportion of monounsaturated fats, like olive oil and avocados, and reduce saturated fats, like butter and lard. Opt for leaner cuts of meat and incorporate fatty fish for omega-3 fatty acids. Eliminate sugary drinks and high glycemic foods from your diet. Choose whole grains and fiber-rich carbohydrates instead. Experiment with caloric restriction, which is eating less overall, dietary restriction, which is limiting certain food types, and time restriction, which is eating within specific time windows to find a sustainable approach. Use tools like blood glucose monitors or regular health checkups to track the impact of dietary changes and adjust accordingly. Incorporate a mix of aerobic and strength training exercises into your weekly routine to enhance metabolic health. Chapter 16. The Awakening. This chapter emphasizes the critical importance of sleep for brain health, metabolic function, and overall well-being. Prioritize sleep. Use sleep trackers or questionnaires, like the Pittsburgh Sleep Quality Index, to monitor and understand your sleep patterns and quality. Ensure your bedroom is dark, cool, and quiet. Avoid bright lights and electronic screens before bedtime. Limit alcohol to 1 drink before 6 p.m. if necessary, and avoid eating at least 3 hours before bed. Limit caffeine intake, especially in the afternoon and evening. Go to bed and wake up at consistent times. Allow for at least 8 hours in bed each night. Engage in regular physical activity, but avoid intense workouts close to bedtime. Utilize relaxation techniques like meditation or reading before bed to calm the mind. For persistent sleep problems, consider cognitive behavioral therapy for insomnia. Chapter 17. Work in Progress. This chapter emphasizes the interconnection of physical and emotional well-being and the importance of acknowledging and working through personal trauma for overall health. Reflect on past experiences. Recognize how these experiences may impact current behavior and emotional health. Engage in activities like meditation or nature walks. Focus on the present moment to manage stress and increase self-awareness. Apply dialectical behavior therapy techniques such as emotional regulation, distress tolerance, and opposite action. To do this, use a DBT workbook or seek guidance from a DBT therapist. Be aware of emotional triggers and stresses. Utilize techniques like cold showers or deep breathing to manage emotional distress. Incorporate regular exercise, like rucking, into your routine. Use it as a form of moving meditation and stress relief. Spend quality time with family and friends. Practice empathy and understanding in interpersonal interactions. Listen to and adjust negative self-talk. Replace harsh judgments with kind and forgiving thoughts. Recognize and embrace your potential for growth and improvement. Personal transformation is achievable. If needed, seek professional therapy. Thanks for listening to this Functional Health Coach audiobook summary. If you have any questions or comments about it, please share them with the community. See you next time.